Sphenoid sinus mycetoma. In this project, we report a case of isolated sphenoid fungal sinusitis, which presented itself only as a headache. On examination of the nasal cavity, there were no intranasal abnormalities. A CT scan revealed a heterogeneous opacity with microcalcification involving the left sphenoid sinus. Microcalcifications, antrostomy and posterior ethmoidectomy as landmarks for constant orientation, middle turbinate lateralization, access to superior turbinate, sphenoid sinusotomy and sinus content. I start to evacuate the cavity. Using marrowcell sponges to clean the whole area. until healthy mucosa is evident. One week after surgery, nasendoscopy. Watch this putty-like material in the floor of the sinus that should be removed during the early post-op period. Watch also that some hyphae remain behind on the sphenoid's floor despite the meticulous sinus cleansing. Here, while the roof of the sphenoid has already been cleared. During the next 6 weeks post-op, we performed via an intrasinus catheter sinus rinsing with amphotericin and betadine solution. Final comment. Purulence in the nasal cavity, nasal obstruction, hyposmia or anosmia, and/or fever, developing simultaneously with onset of acute exacerbation of acute or acute on chronic rhinosinusitis, is supporting the diagnosis of sinus headache. Consequently, the diagnosis and treatment of sinonasal pathologies are relatively easy because symptoms and signs are obvious. But in the case of the sphenoid sinus, including isolated sphenoid fungal sinusitis, due to lack of nasal symptoms initially, these patients do not present to ENT surgeons but to neurologists and neurosurgeons for vague symptoms, especially headache. Physicians should be aware of this rare clinical entity and recommend complete rhinological workup in the intractable headache patient. As in many cases, early diagnosis and appropriate treatment provide the key in achieving favorable outcomes. To our experience, cleaning the sinus regularly during the post-op period with intrasphenoid catheter is of the utmost importance for successful results. This video is for educational purposes only. Thank you for watching.